Interactive. I know the topic is digital health and entrepreneurship, right? So I'll talk a little bit about that first, and then we can jump into whatever you guys want to talk about.
So maybe you can tell us about your lead company.
Yeah, and then I can introduce myself. And I know that's important part of entrepreneurship, so at least from my experience and my we talk about that. But before we just get started, I think all of you take, UPID for granted, okay? But how many of you realize that it is really very unique in the world? UPID, the payment system. So you all know that it is extremely unique in the world, right? And why do you think it is so successful in India? This is one that is easy to use. Okay, everybody would have wanted easy to use, but it is definitely easy to use. Yeah?
And it can be implemented on a thing that is in your pocket.
Convenience again, yeah.
Ability to link with mobile.
Okay, ability to link with
Believe
mobile.
that no fraudery is happening and the money is safely transacted.
Is safe, secure, yes.
It's getting populated when it was demonetization.
So there was a strong impetus, right, for demonetization. What else? Any other? Interconnectivity, interoperability. Okay, very nice. Okay, what else?
No hassle of carrying currency.
No hassle. Yeah, it saves big burden of carrying currency.
Smartphone penetration in India is quite high. Although US also is quite wide, it has not taken off yet.
Yeah, yeah,
So it would reduce the burden of currency printing and all that.
absolutely. Yeah.
But pickpocketers are losing jobs.
Everything. It's unfortunately in this case it's pickpocketers that are losing jobs. In case of digital health, it will be doctors or hospitals that might lose jobs. So that's a little, it's not really exactly losing jobs. But it's, there's a human tendency in that. But any other thoughts from you guys?
Due to maybe COVID, India is moving to the digital world as well. I don't know exactly that it's related, but this is one of the.
I think Paytm really pushed it, but demonetization really pushed it, right? But I think you already answered majority of what I was looking for, right?
Currency inflicted a spread of diseases.
Yes.
A lot of hunger.
Yeah. No, absolutely. That's a benefit that we may not have expected, but we automatically got that benefit like touchless, right? But if I just summarize what we talked about, it's convenience, it's the mobility aspect of it, it's safe, secure, what else? Interoperable, right? But those are essential characteristics of any digital adoption, right? All of those are absolutely applicable for digital health as well. So first I'm going to talk about so this is true, right? With so much effort, there's been ungodly amount of money and effort put into trying to push digital health for at least more than a decade now, right? And I'll just talk about some of the challenges in the US and why India is very uniquely set up to really shift digital health, just like how digital finance shifted, right? And then we can get into entrepreneurship and the opportunities that you guys have to take advantage of that momentum that is actually brewing. It's very ripe right now. Okay, so let me touch on these fundamental things that we talked about. First, having that digital equivalent of digital currency, but a digital health record. Right? Then I want to be able to share that health record, and in order to share that record, I need consent of people. Right? I want to be able to share it to somebody else. I should be able to control that consent. And then when I give that consent, it needs to be interoperable, right? So if I look at these three areas, okay, UPID is actually based on, having Aadhaar card and having one ID and all that, right? So it was an infrastructure that was built incrementally. It was, I believe, in Clinton administration time, probably when maybe 20 years now, right? There was a bill, there was a law that was passed in the U.S. that said that there shall never be one unique health ID. Okay, and it's very fundamental to have, just like UPID, it's extremely fundamental to have one health ID or one ID. Right? Otherwise, what happens is that my same record in my doctor's office, in my hospital, in my lab, it's just sitting with different IDs. Now, how do I even consolidate my records, and how do I trace my records? Right? Now, why do you think they passed a law to say that there should never be one unique health ID? Well, they use privacy as a nice scare tactic, right? But there is inherently there's motivation in the system to not share. And I'll talk about the political barriers that are there.
Prevent it from being privatized, maybe.
It's not being privatized.
To prevent it from being privatized, like maybe government won't have.
It's not that the doctor finishes their job. It is basically, if I have a health system, if I have a hospital, even in the U.S., just like how you have, Apollo as a health system, and there are existing health systems in India, right? Likewise, even in the U.S., every city has its own health system. So, it could be Brigham and Women's in Boston. It's a Harvard health system. Duke in North Carolina, Baylor and Scott. So every city has their own health systems, and they want to keep their patients within that health system. And if they lose patients, then they lose the income. Right? That's from a health system perspective. Right? Then the people that are building the electronic health record system, right? So there are two major companies. One is Epic and one is Server. These occupy about 80% of the market, right? And they don't want to lose, because they want every hospital to use their systems, right? So it's a nice collusion between the hospital systems that don't want to share and these IT systems that want the hospitals to use their applications. So at best, they will share only amongst their systems. That too, if the hospital systems want to share, right? And so the lobby powers and everything that they have, that's one aspect of it. So they took care of it by saying there is no one unique health ID. By the way, none of these are going to, eventually it's going to progress. There'll be ways that it will be solved. But I'm just telling you the challenges. So then during the Obama administration, when 2008, and some of you may or may not even have been very active in your lifestyle in 2008, we had a massive scale financial meltdown, right, in 2008. So at that time, that was when President Obama was elected, and that was when they were picking, when government was pushing money to prop up jobs and stuff. They picked these shovel-ready projects that they call, which is like laying infrastructures and roads, so to create employment, right? The first project that was picked was creating health records. So really, they gave away almost $50,000 per doctor's office to create these. Everybody got that, and they turned up that electronic medical record systems. But unfortunately, we all have it. Go to any doctor's office, any lab. It's not lack of those existing, but they can't share with each other. There's no one ID, right? And also, like travel industry and finance industry, we don't even have to talk about creating this interoperability standard. In the health industry, the interoperability standard, what's called HL7, and most of the FHIR standards that are continuously being developed for the last 20, 30 years. Because of this lack of motivation, it just seems like an endless cycle to have that interoperability standard, right? And then the consent that I talked about, where patients need to give their consent. So most of the time when we go to different, let's say I have a severe back pain, and I go to the, or I go to my, neurosurgeon or whoever is going to help me out, and then they ask me, hey, can I use your data for others that have back pain? And I say yes. And it's known that 80–90% of the people actually give their consent. But interestingly enough, they don't take their consent digitally. They take the consent on paper. Right? To the outside world, it looks like nobody wants to share their information, it's privacy. Reality is that even people want to share their information. Right? It's a lot of political barriers that exist. And the other barrier that exists is you're given as a doctor, you're given license only at a state level. So literally, if someone in Punjab wants to have a telemedicine call with someone in Haryana, you can't do that. Right? So the point I'm making is digital health being successful is just really, protected from so many angles, right? And it's an existing ecosystem where there's a lot of money in it, and everybody is trying to hold on very tight to access to their money that they have. Now, if I bring the situation to India, right, the need exists and the value exists. Right? So everybody, it's still actually mostly, and another bigger problem is that ultimately it is the patient paying for it. But for the patient, it doesn't look like as if the patient is paying. It looks like as if insurance is paying. So you want to demand, whenever you're demanding something, you're demanding it because you're thinking you're not paying out of the pocket. But eventually those costs come down to the patient. Right? Here the system is not like that. Patients still directly bear the burden, so there's motivation in the patient to do the right thing. And the availability or accessibility of care is, I wouldn't say, even here I think it is actually still accessible. As much as you think about it, it's not accessible, it's still accessible, right? But if you go to the remote areas and you look at it from a government perspective, not from your individual, all of you may not find it difficult to access care, but there are people in remote villages that have the difficulty, and if the government needs to solve their problem, government is motivated to do something, and digital health is their only weapon to make that change happen. That kind of problem doesn't really exist in the US, right? So interestingly enough, I was super surprised to see that the Indian government, the National Digital Health Mission now, which is called the Ayushman Digital Health Mission, that was there even pre-COVID, actually. And the architecture that they created is based on FHIR standards with the right interoperability. Consent management is something that they are providing, and it is under the law. But let's say you went to some hospital system, let's say you went to Apollo, and then you want your record here into local hospital, and you give a consent and you say that my record needs to be moved here, they can't say no to it. I'm not, just because the law is like that, it's not going to magically work. Even here there will be a ton of resistance, right? But just like UPID, I mean, if this whole Ayushman Digital Health Mission was as mature enough, like the way Paytm was when demonetization hit, if they had done enough work, COVID would have just really, it would have helped that digital health, take off in India exactly like how UPID took off, right? I mean, even during demonetization was really not UPID, right? UPID came later on, but it created enough impetus within the ecosystem to allow for that maturity to UPID, right? And there will be a lot of resistance at the hospitals that control, but it is sort of like what is happening to Paytm now, right? So if Paytm asks you to pay money for depositing it into your banks or whatever, right? You're just switching away from Paytm, going to Google Pay, right? So the same thing will happen if the hospitals don't collaborate. Once the system is in place, right? If the hospitals don't collaborate, patient has the power. So they're probably going to go to the hospital that is freely providing you your information, because you don't want to pay for multiple lab tests. If you're going from a specialist to a specialist, you're not going to get the same MRI and same reports, same blood reports over and over again, right? So I think there is an enormous potential for digital health to take off, and it will absolutely take off in India. It's a matter of time. It's just that everybody saw the success of UPID, right? And everybody wants to be the next Paytm. So when they all come, these big superpowers come, and they're grabbing their piece of the pie, they'll delay the progression in digital health, but it is going to come, right? So now that at least you understand the potential of it, you understand the opportunity, let me just shift to the entrepreneurship topic. So assuming that for those of you that want to be entrepreneurs, right? The need is very real, opportunity is very real, right? So, but first of all, I will say one thing: don't be an entrepreneur for the sake of being an entrepreneur. Okay, just because you think that that's a respectable thing, being a CEO, owning your own company. The amount of pain that you have to go through may or may not even be worth it. Like, you have to really question what gives you that happiness. Like, why do you want to be that? Right? If you're just doing it because of recognition, it's not going to be sustainable. You won't survive, right? But now let me just tell you my story and how at least I continue to maintain that motivation. So in 2007 timeframe, I was working for Centers for Medicare Medicaid. Centers for Medicare Medicaid is same as Ayushman Bharat in the US. That's who provides, it's a government insurance program that provides medical insurance for poverty, people under a certain poverty line and adults, right, or elderly population. So that's how I got exposed to health IT. That's when the Office of National Coordinator was created, where it was pushed by the government to do digital health records and all that. But all these challenges that I could see over time, I could not, I could see that it's going to take a while for that to work, right? But at the same time, my mom was diagnosed with leukemia in India, and I had a very enlightening experience at that time. It was a very, very bad situation because we had to take her from our town to a city. She didn't want to be, treated at all because it was known like a 6 months prognosis situation. She wanted to spend her time with the family and her friends, but we still couldn't just leave it like that. So we took her to the town, to the city, and then what I found was most of the care was she was just staying home, and then we would have the lab person come home. They would take a lab sample, get the report. I would take the report to the doctor. The doctor would look at the report and would change the medication. I would call the pharmacy would deliver. This was happening in India in 2007, 2008. It's not a digital economy, nothing like that, right? It is how the community functions, right? So it was okay for us. We could afford to have her in the city, but there was, if somebody cannot go to the city, do not know whether they can even see the doctor when they go to the doctor, all the pain that they have to go through by, traveling in, rickshaws and autos and buses and trains to get hours, that's just not worth it. So I thought I'll take my knowledge and in this passion to solve some problem. And in 2008, I after I went back, I was trying to find Google and trying to find how can I get this, what I said, some hosted electronic health record. And somebody posted instructions on Amazon Web Services, and I was just completely blown away. In 4 hours, I could have that up and running, just following instructions, and it cost me 60 cents, right? So I knew that whatever that was is going to change the world. Because at that time, my thought process was that internet only democratized information, whereas this is democratizing compute power. So only, you could be like a National Institute of Health or Goldman Sachs to have the money to take the information, compute it, convert it into knowledge and take action. But if the common man has the ability to access that compute power, and you can take the information that's available and then take action on it, then it's going to change the global scene. It's going to improve the productivity of health, right? So I was big gung-ho on that. It turned out to be Amazon Web Services. Nobody was ready for that message in 2008. But when President Obama came and he happened to use cloud, so he announced a Cloud First initiative. So my knowledge was the right time, right place. So I became the advisor for President Obama on his Cloud First initiative. And then I was thinking, okay, good, I'm doing this, but I'm not going to get to my goal. So I left that job and I went to Amazon Web Services when they started their office. I was their first employee for worldwide public sector. It's headquartered in Washington, D.C., that's where I am, right? And then from there, after 2 years, I found that I'm not getting to do what I want to do, so I had to leave and found my own company, right? And that company did really well. We were recognized by Gartner. We were top company in Northern Virginia. We won a very large contract with the U.S. Department of Defense, nearly $1 billion contract. And then the company was acquired by Hitachi. But then I had to still say, I'm going to leave that because I have to come to pursue my, what I want to do. So why I told you all this is...
What does Rean means?
Reach, engage, activate, nurture. But we were a cloud services company, and Rean is the outcome of cloud. Right? So that's why we didn't have Rean, but Rean, and it's also my daughter's name, it's Renu and Anu, so it's half Renu and Anu. So they're like these 3 things, and we came up with that name. Right? So anyway, what I was trying to say from an entrepreneurship perspective is you have to have a driving passion to do something. Because if that is not driving you, then the number of hurdles you face, right? The entire world thinking you're the most stupid person in the world, you just don't know what you're doing, you're running around crazy, you're making people run around crazy, what is it worth? It's just a lot of, and no MBA will teach you lessons to be an entrepreneur, right? Because when we had that $1 billion deal with the US Department of Defense, like Oracle was after us, and Lockheed Martin was after us. All of them wanted to say, why did you give such a contract to a small company like this one? And they were trying to prove that we could not meet the government's needs. So, and the government, because they sued the government for giving us that contract, government was not paying us money, right? So what do you do if we stop providing services to the government? That means Oracle and Lockheed will win. If you provide services to the government, we will run out of money and we'll die. Right? You can go to Harvard, but nobody will give you an answer to this. Right? It's just how you maneuver the circumstances to live with that, and it's the people you trust that will support you. Right? So it takes a lot of willpower to do it. It is a lot of fun. The return is just amazing. So what you should absolutely try, but try with a very clear passion, and passion should not be your technology. Don't think, I want to be an entrepreneur because I want to do machine learning or I want to do something. No, it has to be, you need to be very clear whose pain you're solving, right? 100% clear. And also remember one thing, that that pain, if you're solving a pain of 1 million people, let's say you're working on a vaccine and you're getting to millions of people. When it is a millions of people, it's a statistic. If it is one individual story, that's what you can relate to. So really find that value, that need that you can really see. It could be your mom, it could be your aunt, uncle, brother, friend, whatever it is. It doesn't mean that it has to be health oriented, even if it is finance oriented. It doesn't need to be charity either. In fact, it is better it is for profit, right? But if you can align your passion, your interest, and how do you know that your passion is aligned is, for me, the litmus test is the following, right? If I work all night, in the morning I'm still energized to continue with it. When you are there, then you know that you are working on something that you're passionate about. And rest will sort itself. It might take a lot of ups and downs, but you will be successful. Okay? Yeah, I mean,
So what did you do in that situation when the government was not paying?
so we went to our investment, our venture capital firm, and we told them. I mean, they were really nice. They could have really taken a large cut of our company to give the money, but they knew that we were eventually going to get that money. In fact, government paid us back with penalty. Like they themselves, paid us a lot more than they owed because of what they've proven. But it's a situation. Would I do anything different if I were to redo it? Unfortunately, no. I mean, I would still stick to. I might as well just go bankrupt. I'm not going to let Oracle or Lockheed, right?
So who are your major clients?
Now it's Rean Foundation. It's not Rean Cloud anymore. But I was telling my Rean Cloud story. So your question was back then, who are our major clients? We are mostly focused on regulated industries, financial services, and healthcare. Financial services, we had Vanguard, Citibank, Credit Suisse, a lot of financial services. And life sciences, healthcare and life sciences, we had American Heart Association. We actually built their precision medicine platform for American Heart Association. Novartis was our customer. Canadian DX, it's University of Washington. Yeah.
But then why foundation? Why not a for-profit?
So the way I look at this, so now if I'm looking at from a healthcare perspective, understandably the money in healthcare is where the patient meets the provider, the doctor, hospital, right? And no matter what we say, the interest is in patient going to that place to get service because that's how they make money. Okay. But from an outcome perspective, at least what I see is, we tend to think, do I have the best doctor? Do I have the best hospital? Do I have the best, lab report, right? But the reality, for a time being, just assume hypothetically that you have unlimited access to money, unlimited access to doctors, medicines, everything, right? I believe it is still the patient and what they do, like meaning, are they taking the medications properly? Are they tracking their symptoms properly? Are they tracking their vitals properly? Are they eating properly, exercising properly? Mentally exercising, physically exercising properly, right? Now, in order to drive that behavioral change in the patient, right, there is no money in that. In the US, it's very evident that the money is paid by ICD-9 codes, and there are no codes. It's changing a little bit, right? In India, again, you see that there are corporate companies giving you that incentive to keep people healthier. Those things they don't exist in the US, right? But my thought process is, how can we make that difference? And when you're trying to make a difference where there is no money, it's best to be a non-profit because governments know that there is a problem. Foundations like Gates Foundation and the Clinton Foundation, they all know there is a problem. Right? Preventative health, behavioral health, there is a lot of money. It's not that there's not money, but it's not a for-profit money. And you can't, at least I feel like it's going to be a while before for-profit organizations are successful in that area.
So what is your plan about, or do you have any plan about implementing it to rural area?
But that is the idea. That is the whole idea of what we're trying to do. So if I kind of go, take a step further, right? Anybody, whether it is rural or urban, the behavioral change. So let's say, you know, we know that we all need to wear a problem in the US alone, right? And 1/3 of them end up dying as a part of that procedure. That could be another $100 billion problem. But why wouldn't they take their weight every day? It's very simple. But from a human perspective, it is like you took your weight for 100 days, 200 days, nothing changed, so you give up. So how can we make something so convenient that if they sleep on their bed and get off their bed, if their weight is taken, right? Same thing, like from a medication adherence perspective, everybody knows the medication adherence is the problem. And so one of the things that we're designing with, Professor Ashish here and the team is a pill bottle, a water bottle with a pill compartment. So you take, very convenient, just take a pill and drink water and keep the hydration adherence and medication adherence. To answer your question, what we want to do is create these very simple solutions and in local languages. So Hindi, Haryani, Punjabi, they just need to be able to, in WhatsApp, right? They need to be able to say that. It's almost like if your granddaughter is passing by and you say that I have chest pain and I'm recording that. Why they fail? You can hear that as sales and marketing failure. But what is sales and marketing failure is conversion failure, is behavioral change failure.
So do you observe any complexity of the problems associated with the elderly persons in accepting digital health?
Actually, I mean, the studies clearly show that we think that the elderly people.
Is there any paradigm shift in their understanding?
Yeah, it's actually, I think, so what I was trying to say, first there's elderly people are not very used to digital technology, they don't use phones and things like that, right? But that has been, in studies over studies, it has been proven wrong. That actually 70-80% of elderly are very comfortable using it. What I think, it's not an elderly person problem. If I am I'm a very, technically savvy person. If I get sick and I'm on a, sick bed, and you tell me to open an app and indicate my symptoms, are you getting better? How are your vitals? I don't want to do that. It's just a painful thing, right? So I just think that we tend to focus on elderly, but the technology today is not convenient enough to influence my behavior change, right? And if I have vitals, I have to get a blood pressure cuff that is Bluetooth enabled. I have to get a SpO2, that is Bluetooth enabled, and then I have to spend half an hour in the day to get through all these things. Why would we want to do that? I mean, even today as we speak, there is no one simple solution. In 30 seconds, it takes all my recordings. Right? We are far from that, and that's why we're not getting that behavioral change. And I think when that happens, the shift will happen. It's not because of elderly or not.
Another question, because you have also worked with Thai universities, so what is the challenge in terms of promoting entrepreneurship in universities that you see, especially bringing in syncing university with entrepreneurship?
I think organizations like Thai or for the university for that matter, they are just an enabling platform, right? But it's really the entrepreneur of you pulling and taking advantage from that platform.
But are the universities enabling enough?
If universities, let's just say that if universities are not enabling enough, Thai University was structured for universities, right? Likewise, it's just not Thai. There are so many organizations that that provide this capability to a student, a university student, right? Now, but the challenge is, a student has too many things. Should you focus on your grades? Can you just quit that and really focus on your entrepreneurship venture? If you do that, yes, you might get an entrepreneur mentor, but you may not get, how you advise your students. Like when we were talking about it, right? We were talking about grooming someone to be multi-skilled, like the mechanical, electrical, computer software. I just think that, you getting access to something like that is very, very unique. I mean, you can, I will give you a lens to what MIT is like or Harvard is like, but even there, you won't get such an access. At that point, when you have all these things, some form of funding is there, some form of, not some form, very good form of advice is there, capability is there. I mean, it doesn't make a whole lot of sense, to go try to pursue 100 other things, right? Are we recognizing what is right in front of us, right? I think if you do that, you may not be successful in the very first venture you undertake, but I mean, you're out of school, you're leaving with an experience of being an entrepreneur. I mean, you're 1/100th of 1% in the world already, right?
And especially another thing with our students in India, sometimes I see is that they want to do, for example, bachelor's they did, then they want to do master's, then they want to do PhD, just go on with it's like a linear flow without, and that what to say, there's a risk profile, like to the ability to take that one risky move in life, even within university, while they are still in a protected environment. That's also very rare to find.
Yeah, and I think there's some of those things are so unfortunate. It's sort of like you have to go through an experience. Does not matter what you do, right, or what you learn. You only apply 10% of your academic knowledge in your life. It doesn't matter. It doesn't matter what you study, right? So, what are you trying to achieve by studying more and more when you don't know where you're going to apply it? Instead, I mean, really what organizations like this, right, like IITs and students like you that made it here, the number one thing that differentiates you is your ability to learn. That means you have learned to learn. Not what you learned, you have learned to learn. And you have the confidence to learn whatever comes your way. Right? And you achieve that state by the end of your bachelor's. Master's and PhD, I mean, if you want to be a professor and you want to share knowledge, yes, absolutely. So, you should do that. Right? But if you want to be an entrepreneur, that's not what is, that's not what is going to get you there. Right? You may, after you go through a certain level of, entrepreneurship, you might find a field where you're so passionate about learning very deep in that field. Yes, absolutely. I mean, you can do PhD, but do PhD part-time or, there's so many opportunities like that. But just running around trying to get more and more degrees, I mean, I actually find that to be a very South Asian mindset. I am from here, but I'm just telling you that, even my friends there, like they want their kids to be doctors, their kids to be engineers, and it really doesn't matter. I mean, I've known so many of, like my wife didn't do any engineering, but she's she also, was a, software engineer. She also was an entrepreneur, right? But you can be, and as long as, especially now, there's so much access on YouTube, and you get one of the most brilliant lectures. I mean, you can hear Elon Musk talk about it, and Jack Ma talk about it, and the professors talk about it. Like, how else can you get anything more than that?
Can you share some of your experiences? Suppose our students want to enter into digital health entrepreneurship. So, what do you perceive the future? I mean, maybe the challenges or the complexity they have to face.
Yeah. So, see, you think? I mean,
which may be quite a gray area. They should enter.
Yeah, it's there's actually a very good TED talk that has like so just to be successful, like as an entrepreneur, right? Is it the idea? Okay. Is it the team? Is it the leadership? Is it the money? Is it the timing? Okay. Yeah. So it's really, one thing you need to remember is that it's not that the others are not important. Timing is the most important, and idea is the least important. Okay. We tend to ignore, we tend to flip that mostly. Right? You're so caught up on the idea, and especially young. I mean, if there is one advice I can give you, you try to hold on to your idea, share your idea like crazy. Just be open about your idea, okay? Because that's when you get your feedback from multiple people, and you will know whether you still want to stick to it or not, or whether you can stick to it or not, right? Because end of the day, I'll give you an example. Like Hitachi claims to have the most patents in the world, more than GE, more than Siemens, more than IBM. Okay. Those patent lawyers, any patent you want to take and convert into a product, the lawyers will come, and they are trying to figure out how much money you're going to make. How much do we pay? Nobody has made a dime yet. In the meantime, you've spent ungodly amount of time, money on these lawyers, and those go nowhere. Right? There are very exceptional cases where, like Qualcomm patent, there's some very unique patents, sure, right? But majority of the world operates without patents. You get a patent, somebody will, do that and do something else. It won't mean a whole lot, right? Your success in execution, your timeliness, your ability to keep changing your idea to the need, to the value, to the person, right? So one thing is always be laser sharp focused about who is your customer. One customer you can change their behavior, one customer you can convert. That one customer you'll achieve, in your idea you'll achieve 60% already. Then 2, 3, 4, and it will pick, right? So I would just focus on execution, focus on timing, focus on customers.
On the timing aspect, there's the Gartner hype cycle.
Yeah.
Gartner hype cycle, they published it. Like, which technologies are right now on the lower?
I think it's the technologies will go through hype cycle. So because they need, so when there is hype around the technology, so everybody will come and they'll find out all the problems about it. So everybody will go down, and then technology will mature and come back up. So that's a very proven thing. When you're talking about like how we went from mechanical engineering, electrical engineering, within the cycles, the internet, cloud, machine learning, all of those will go through hype cycle, right? But what I am talking about is like if you want in any one of those, how can you hang on to to something? Is you just need to. You don't want to be too early. You don't want to be too late. So it's that timing, and the best way I can tell, unfortunately you don't experience it, but when you are, if you go to a sea or an ocean, right, and when you play in the waves, most of you don't experience it, but if you're on a surfboard, right, if you're just trying to time a wave, when you time that wave, that push that you get is just thrilling. Okay, you have to struggle so many times to catch the wave, but once you catch that wave, you know it, right? That's what I mean by timing. Within these cycles, right? So you will know, I'm not like did we time the cloud wave right? I mean, so in some ways we could have been very early in the cloud wave, right? Maybe there are other companies that there are companies that are earlier than us that had so much funding that didn't do so well. So it's that combination that we can strike in the timing. What worked out for us is maybe being in the DC area when the government was adopting, it's sort of things like that. So the timing I mean is just very unique to your context of what is going on. Like demonetization was a perfect timing for KTM. It's not going to have a cycle or anything like that. They hit that time. But that's an extreme example. I'm not saying that you need to hit a jackpot like that. But anything that you do will still have to go through some proper timing. That's more important, right? Not the idea.
I have to ask some question. It's kind of a
Maybe we'll take this as the last.
Yeah.
okay, it's a kind of an individual question. It's like people who are entrepreneurs, they just like more about interaction as well as networking. So if a person is not that social, okay, I would say that it's like facing a problem in socializing. So how do you think that will impact in entrepreneurship?
I am not social. I'm telling you, really, it is not, but truly, the reason is, it's the passion, right? Network is not about going through 100 people, it's converting one person. Okay? You need not be social, right? It's just, once you know, right, you focus on one person at a time, right? And you take those techniques and give it to other people that are social enough. Because you are the only person that will know how to convert that person. Right? Unless you experience that, you try to convert that on a one by one. Even if you're social, if you're trying to convert 100 people at a time, it won't work. Right? I mean, Elon Musk is an exception. Okay, Elon Musk is a brilliant person that converts masses. Right? But you're not. I mean, I'm not. You know, not. You don't want to be an Elon Musk or a Steve Jobs. One of you are. It's great. What's that?
He was also an introvert in his school time, and we have heard that he was most of the time, but he is so successful. I think that.
But he has a good stage presence. Like he can actually go
Yeah,
and.
he can create the hype. I mean, just my perspective, like Tesla sucks, but you know, it's just everybody's. But everybody, I can't even go to a Tesla group and say that something genuinely wrong about Tesla. They will just beat you out. Right? So he created that kind of a hype in that. So.
Sir, I have one question, last one question. Like, if you can step back, why not digital food records instead of digital health records? Like digital food records, we can find out what we eat and what we don't, and we will take a probability algorithm that if you are eating so and so food, you have a probability of occurrence of a particular disease. Why not food records, digital food records?
I think that's also part of it. It's a very important part of it.
Right.
Nutrition, food, what you're talking about. That's why I said vital symptoms, nutrition, exercise, the records of all that are very important. It's not one or the other. It's combination. Sleep. Yeah. Okay, I think.
Okay then. So thank you everyone
Thank you.
for coming over and.